Again, just to say, this was definitely something that was done by Emilie Johnson. She started putting this together, and then I just did a few additions, alterations, added some pictures. And then I'll go through this, and then we'll let Chris, who is across the room from me right now, finish his part, and we welcome him back to us again. So it looks like mostly nurses, paramedics, EMTs, looking at ATV and off-highway vehicle safety rules. I was actually in an off-highway vehicle this weekend. Lots of fun. Wore my seatbelt. Just want you to know that, Chris, as we're sitting in the room.
That's an important thing.
All right. So most of you guys know, if you're not familiar with riding, most of the common accidents are head injuries. You get spinal cord injuries, fractures, amputations, partial amputations. You can get internal injuries. So essentially, you can get almost any injury you can driving a car on OHVs. And sometimes because you're not strapped in, especially on ATVs, it could be a little bit worse because you're going to be ejected. You're going to get thrown. So thinking about that, when we're going through this, we're just going to go over these most common injuries. So head injuries. I mean, anybody want to jump in the chat, come off mute, tell me what's wrong with this picture. One, hope that he doesn't run over the guy standing at the bottom or right below him. Two,
no helmet. No helmet.
No helmet. No
standing up down a hill. Looks scary.
He's not shifting his weight to the rear.
Yeah, not shifting. He's leaning forward. So the chance of his maybe going like this, high possibility, right? So again, wear a helmet. Okay, we're going to talk about this. Head injuries are not sexy. Okay, they're not fun. And I talk about this a lot because we played with the chances when I was younger, right? I rode in the back of a truck. I didn't wear a helmet. I was lucky. Let's just preface lucky that I did not get one of these injuries. Can't say that some of my family members didn't, but I did not get one of these injuries, and I'm lucky because of that. Does that mean my parents weren't taking safety precautions? No, it's just what they knew at the time. That was what was normal. So we just need to change the normal, okay? Just because we didn't get injured as kids does not mean that we want to take that chance or roll the dice with our own lives, with our loved ones' lives, anybody's like that. So again, wear your helmet. And Chris will talk about more what exactly is DOT approved. He's going to let you guys know what that means, sizing, all that fun stuff. I have a really small head, so small helmet for me. But again, head injuries, not sexy. Don't do it. He'll also talk more about vehicle training, what you can do, classes, things like that. Speed is always going to be a problem, right? Speed is going to be a problem anytime you drive anything. I'll do this. Sadly, I was coming home from camping this weekend and saw a semi-trailer go right through, didn't see it personally, but after the aftermath, go right through a motorhome. Doesn't mean that speed was involved, but stopping is another part of speed, right? If you're driving a big vehicle or a heavy vehicle that you're not used to and you don't know how to stop well, it's going to be a problem. So don't go too fast. Again, 16 or supervise your kids. Under 16s account for 25% of all injuries. Reason being, of course, when we're kids, nothing's going to happen to us. We're resilient. We are untouchable, right? Unbreakable. And probably going to take a little bit more risks. So just making sure to supervise and just making sure they're being safe. And I'll let Chris go more into that about how to make sure that your kids are safe. What's the safest way to go? And then again, staying off the highway. So ATV injuries, accidents can take place on roads or highways, not off-road, and they weren't meant to be used that way. There are some that are street legal. There are steps you have to take to make them street legal. And again, I'll let the expert go over that kind of stuff. Of what to make them street legal, but make sure that you know that. If you have to go next to a highway or road, be off to the side, go very slow. And again, you don't want to have these accidents take place. And again, you don't want that head injury. You don't want to go up over the handlebars. Again, like this guy, maybe tumble down the road, anything like that. So thinking about your head injury, and again, care of the head injury patient. So obviously, if you're just responding 911, just call 911 straight away. Okay, that is the number one. You'll see this throughout the slide deck of call 911. So the problem is if they have a head injury, you don't know what kind of breathing status they have, you don't know what kind of ventilation status they have. They may need to be intubated, ventilation, things that you don't have on scene with you when you're responding to an accident. So again, knowing their needs, calling 911, getting help there right away. All of you guys that I saw in there, most of you are healthcare providers. So if you are far away and you know this person is sick and you need to launch a helicopter on 911, you tell them, I need a helicopter. Get both of them going. I work with obviously a lot of people who fly, and they say that they have zero problem launching a helicopter and having to cancel. Zero problem, because guess what? They get to fly and they don't have to do paperwork. So they don't care. So if you guys get there, that's great. If they don't need a helicopter, but launch one, because you never know. And it's very important, especially with all of these different injuries that we're going to talk about. Getting to a hospital, trauma center at this point in time, they need a trauma center, is the best thing for your patient. Knowing your GPS coordinates, or if you watch Up, GIPS coordinates, right? The movie Up. And again, because you don't know. I had zero cell service when I was camping this, and it was glorious, let me tell you. Zero cell service all weekend long. But at least I knew where I was. I've been camping there for years. So I know where I was, and I can explain to people where I am if I need it, but I'd have to drive down to get cell service first. So again, having a plan for yourself, for the group that you're going with. So if you're going riding with a group of friends, knowing that, if somebody gets injured, do we have things to take care of them? Who's going to call 911? Having GPS, that all of these people have something like that. And then spinal immobilization, if you can. All right. So a lot of times, if you're familiar with the Nexus criteria, that's used a lot in EMS. So it is a criteria that's used to clear the spinal column, or to say, I don't need to put them in a C-collar. Let me just tell you right now, having a head injury is a distracting injury. You will always keep them in spinal precautions, okay? Because they are not able to tell you if something is really wrong or not. So still, you want to palpate down the spine. You want to palpate on this where the C-spine is and see if they have any pain. You also want to know, is there any alcohol or drugs on board? Again, do they have a distracting injury that might be a fracture? Something like that is going to keep them. But head injury patients have it. That is a distracting injury. They are not Glasgowing at a 15, and they need to be in some sort of spinal precautions, whether that's just you keeping them still. And again, head injury patients can get agitated, right? We don't know what's going on when you have a head injury. You can get very anxious, very agitated. Holding them still might be very, very difficult. But a lot of times us as humans will hold ourselves in a position where if it hurts, we're not going to turn like this. We're going to be like not moving. We're going to keep ourselves in somewhat of a good spinal precaution. So you do want to try and keep them still, keep their neck still, especially if you know the mechanism of injury. We all know mechanism of injury is huge. Did they go up over the handlebars? Were they thrown off the bike? Were they found 20 feet and confused? Do we know, especially big head injury, were they wearing a helmet? Okay, that is huge. If they were not wearing a helmet, you can pretty much guarantee there's probably going to be a head injury. And if they were wearing a helmet, is the helmet damaged in any way? Is it cracked? Is it broken? If you crack a helmet, think about the impact that you just had on your head. So you want to save your noggin, wear your helmet. I'd rather have my helmet cracked than my head cracked. Okay. And remember, we're going to just put this: head injuries, not sexy, wear your helmet. All right. So reverse Trendelenburg, which is just that you are tipping their head up a little bit. This reduces the pressure that's up on the brain. Again, you don't know what their intracranial pressure is on scene. You can't make that call, but you can kind of tip them up if they need to be in spinal precautions, laying them down and maybe propping them up on your thighs if you're sitting down straight or something like that, keeping their head still if they will hold still. Again, we know that that's not always the case. And sometimes you just do the best you can, and that's all you can do. If you don't have resource, or if you do have resources, like maybe you are coming on the ambulance or you have some good supplies, I have a pretty good first aid kit that's always in my car. Doing neuro exams is huge. Pupillary exams. So one of the biggest things that you can look for is pupillary changes, which will let you know very quickly if there's changes in the brain pressure, if there's swelling, if there's compression on somewhere. So again, doing that pupil exam and doing it frequently is fantastic. Again, if you have resources and you have a blood pressure cuff, monitoring the blood pressure, it should stay above 100 systolic. And like it says below there, one event of hypotension or hypoxia can increase mortality by 4 times in your patient. So making sure that you are maintaining their oxygenation if you can, monitoring their blood pressure, again, should stay about 95%. End tidal, if you have it, again, you might not have it if you're responding, could be 35 to 45, although with head injury patients, sometimes you can manage to be a little bit lower, but make sure you're keeping within that range. And then again, not everybody has this, but if you have hypertonic saline, 3%, if you have that and it's in your protocols and you can pretty much guarantee they have a head injury, you can go ahead and give that normal standard to start as a 250 cc bolus. So looking again, whether it's with resources or without, you use what you have, right? Again, we all know that everybody does the best that they can when responding, especially in rural areas where these are going to happen. All right, signs of increased ICP. Again, these are things that you want to do treatment or get people to care as soon as possible when you see. You don't want to get to the late signs of ICP. So watch for headaches, nausea, amnesia. Behavior changes are huge. If your patient starts getting, or your friend or whoever it is that you're with starts getting a little bit anxious, a little bit more agitated, starts asking questions again, that is a good sign that they have a traumatic brain injury and that they have some increased intracranial pressure. So you want to watch for these early signs. These are your cues. These are huge. These are going to help get your care taken care of. And again, late signs could also be just a devastating head injury that just progresses very quickly. So time might not be a factor on this, but there could be pupils are dilated, they're non-reactive, sluggish reaction to you want to watch for. They could be unresponsive. They could be having flexion or extension. So their hands could be stuck here, or they could be out to their side, kind of pointing outwards, or they're just very flaccid. They're not moving at all. Not really, it feels like no muscle tone at all. They're just flopping around. So look at that. But again, really, really keep an eye out for those early signs of increased intracranial pressure. Those are going to be huge to help manage the care. And then Cushing's response, again, if you have resources to be able to monitor a blood pressure, so your widening pulse pressure. So if your systolic and diastolic are getting farther and farther apart, that's kind of a worry. You need to get them to care. And then bradycardia. So if their heart rate is low, which you expect in trauma, it's going to be high. But you have to look at kind of this head injuries. If you're starting to go down that bradycardia route, you're starting to get very, very sick patient. And then decreased respiratory effort. So they're decreasing their respiratory drive. We always push that if you have resources in your facility, or if you are transporting somebody already on your way to a hospital, and it looks like they are going downhill, maybe they've blown their pupils, maybe they're flexing, they've got this bradycardia, decreased respiratory rate, could be signs that they are herniating. And so definitely hyperventilate at that time. Otherwise, just keep their SATs above 95 and their end tidal within kind of a normal rate. You don't need to hyperventilate them, but if they do look like they might be herniating, if they're getting these really late signs, or again, this bradycardia, decreased respiratory effort, go ahead and hyperventilate your patient. I see a lot of chats popping up. Any questions that I need to stop and answer right now?
Nope, those are all good.
Good.
There's just, yep, they're to you.
Yeah, so again, brain injuries, I just like to show this, right? Healthy people, we can concentrate, we can sense pain, we can sense temperature, we have healthy vision, great memory. Well, some of us still have great memory, but could be going. So that's not really traumatic brain injury, that's just age. Balance and coordination, we've got good vital signs. One traumatic brain injury, guys, one can change these things for you. So looking at that, lack of focus, irritability, difficulty with reading, blind spots, short-term, long-term memory problems, difficulty walking, changes in your breathing, difficulty swallowing. So think if you just continue to get head injury upon head injury, or even if you've had one, you would have to think that your daily life is not the way it used to be. And understanding that as you're caring for a loved one, or you're around someone who's had a traumatic brain injury, understanding what this actually changes and can affect your daily life. So think about that kind of stuff. Spinal cord injury. Sorry, I'm just going to check and see how we're doing on time. Okay. I'll be quicker. That's 7 minutes, I think. So again, 911, you guys are seeing this across the board. Spinal immobilization. Again, especially with like EMS, they talk about not trying to pull them or wrench them out of a car anymore. If a patient can get up and walk or move, they are going to keep themselves in better spinal alignment than you are going to keep them in as a caregiver trying to get them out of a situation. So just make sure that you are doing your best to help keep them in spinal immobilization, keeping them still. But again, if they are getting up and they're already walking around, just try and make sure that they're not re-injuring themselves, maybe get themselves to sit down. But again, they're going to protect what hurts mostly. Keeping the patient flat. If they're laying flat already and they'll stay there, keep them there. Just don't move them. Don't let them whip anything around, not moving their head around, just try and help keep them flat. And again, in these situations, especially head injury patient, spinal cord, especially if they have paralysis, they can't feel their toes, your patient's anxiety is going to be through the roof. The person, your friend, whoever it is. So you need to meet them and bring them down. You need to be very calm when you're talking to them. So if you're amped up and stressed out, and maybe one of your friends isn't, or somebody else isn't, have that other person come in and take over and take a step back, because it's scary. If you've got a loved one that's hurt, it's scary, right? You're going to be just as anxious as they are. As a healthcare provider, we've all learned that we just come in calm. We come in just at a very low level. We don't want to increase the patient's agitation. We don't want to make them worse. We also don't want to give false hope. We know this. If somebody says, hey, I can't feel my legs, I'm like, okay, you can't feel your legs. That's probably spinal cord injury. Or, hey, I think my arm's on the other side of the road. Probably true. But being calm and just saying, yeah, you're probably going to lose your arm. Don't lie to them. But we also, don't give false hope. But be calm and be reassuring. We're still going to help take care of you. We're still going to stop this bleed. Lots of different things that we're going to talk about. So, and again, with spinal cord injuries, if they've got a spinal cord injury, most likely they had a frontal impact and that's injuring something in the spine. So think of those concurrent injuries, which is due to mechanism. Yes, they could have been thrown backwards. It could be like direct on the head that causes spinal cord injuries. It could be they went off, maybe their ATV went one way and they jumped off and came the other and landed on flat on both feet. So from their heels up, it's like an accordion. It can fracture some spinous process, things like that. So thinking about different other injuries that's going to happen due to that mechanism. There's a difference between, like I said, concussion, contusion, transection. You just treat any symptoms. You don't know what those are. And you can try and say, okay, you can see if it's gotten worse, if it's gotten better. If they say, hey, I can't move my legs, check their arms. You still want to maybe check their sensation, see if they can feel dull pain, if they can feel a pinch, if they can feel something sharp or light. If they can do anything at all, give you a thumbs up, wiggle their toes. I always tell people when I'm kind of teaching is if you say everybody's kind of like, hey, squeeze my hands, there are times with different injuries that they can just automatically squeeze as somebody touches their hand. That doesn't mean that they're actually following commands. So asking them to give you a thumbs up, show you 2 fingers, something like that would be better. Again, knowing the difference with neurogenic shock. Can be bradycardia, hypotension. Really, your patient is like pink and warm when they shouldn't be because they've lost that sympathetic tone. So feeling their pulse, if it feels really slow because you're on scene and you can't feel anything else, and they're kind of pink and warm, again, they don't have that sympathetic response. So thinking about there might be a spinal cord injury, something going on there. And then as it says, like you talked about, inflammatory response. So decreased blood flow, and knowing that a difference between neurogenic shock and spinal shock. Spinal shock is transient and will go away. It's just an impact to the cord. Neurogenic shock is probably more of an in-depth spinal cord injury. All right, fractures. I think that top one is if you think about, if you put your arm out to stabilize yourself as you fall, it's not going to be pretty. It's not going to be a good day. And then down here, you can see a pelvic ring fracture. So these are things that you're going to get talking about fractures. Again, a lot of you guys, I think, know how to take care of fractures. If you're in the field, if you're on scene and you come up on somebody and they say that even if they just say their pelvis hurts, they landed that way, put on a sheet. If you have a pelvic binder, put it on. You're not going to hurt this patient by doing that. Okay. If you're able to take a blood pressure and it's low and they say my pelvis hurts, throw on a sheet. Again, it's not going to hurt. It's only going to help. A sheet is like splinting. It also tamponades any bleeds that might be happening. Femur fractures can happen. Obviously, any long bone fractures you worry about. But again, severe shortening or severe pain, shortening of that affected leg, internal, external rotation. It'll usually be swollen. It can be deformed. One thing that you want to watch for is, especially with your fractures, if there's any part of open skin, even if you don't see the bone out, you treat that as an open fracture. Open fractures, I always joke in a class that I teach that it's life-saving antibiotics. But honestly, with your open fractures, antibiotics within an hour could save that person's bone, could save some tissue in there. So we always say that every stabilization's first, ABCs, but antibiotics within an hour of your open fractures. So looking for that kind of stuff. And then again, knowing that you can lose 1 to 1.5 liters of blood for femur fractures, for pelvic fractures, and thinking about the resuscitation that you have. If you're in a rural area, we really only want to give 1 liter of crystalloid, maybe 2 before we start giving blood products, so we're not diluting. So really stopping the bleeding if you can, and then not giving them too much fluid in a trauma. You don't want to do that. And then arm fracture, splinting, immobilization, you do not reduce a fracture. You still want to check for pulses. You still want to check to see if there's movement. That's always helpful, especially if they go downhill and have to get intubated. It is great knowing that they had movement, that they had some sensation distal to the injury before that happens. And then again, open fractures, stop the bleed, moist gauze until you get them to a trauma center. Partial amputation, full amputation. Partial amputations bleed more than full amputations. So it's always good to carry a tourniquet. We teach that and stop the bleed. And again, because your instinct is always to put your arm out, or maybe out of the OHV, whatever you're doing. So make sure that you're just not, kind of tuck that in. Tuck and roll, right? Relax, because they always like the more you tense, the more you hurt when you roll. And hopefully you're wearing your seatbelts if you're in an OHV. So then if you roll and you're wearing a helmet, so then if you roll and knock your head on something, you've got that protected and you're relaxed. I know that it's great for me to say relax when you're rolling in an OHV, but it's probably not going to happen. Unless you're intoxicated, which can happen. And obviously we want to keep those separate. Have a drink, have fun, but don't do it while you're driving. All right, so we talked about tourniquets, 2 inches above the wound, not on a joint until it stops bleeding. If it doesn't stop bleeding and you need to throw on a second tourniquet above the first, please do that. Pressure dressings, packing. If you have not taken a Stop the Bleed class, please take one. It really helps with that. And it usually talks about where to get good tourniquets to keep with you. It's very important to stop the bleed. Packing usually is what freaks people out, but it's a good way to stop the bleed. And then again, these people need a surgeon, so they need a Trauma 1 center. Okay, internal injuries, 911. Everybody's gonna get that, right? 911. Know your GIPs. I think it's because somebody was talking about up this weekend. So GPS, definitive care, is surgery again. What she talks about is initiating that catecholamine release. One thing to think about is when you are in pain and you're stressed out and you're agitated, you have this catecholamine release. And it can mask hypotension, it can mask other things that are happening. So knowing that that's going to happen anyway, but kind of laying them flat. You don't really know if somebody has an internal injury, but if you put your hands on their belly and push down and they have a lot of pain, if it's rigid, if it's super tender, most likely they have an internal injury. So looking at, again, what can happen with that. You're looking at hypovolema, tachycardia, your normal signs for a trauma patient, right? Bruising, looking for seatbelt signs, looking for other signs like, did they hit the handlebars on their chest? You have to worry about more of like a diaphragm injury. You have to worry about bruising of the lungs, broken ribs. So your mechanism is huge. It's always good to know how they crashed, and again, were they wearing a helmet? So looking at your periumbilical ecchymosis or your flank ecchymosis, again, abdominal bleeding. These are usually later signs. You're going to see that when they get them to a trauma center. But if you have a long time before help gets there, or a long transport to a hospital, you want to be watching for these things. You want to keep doing these exams and looking at these, because that could be signs of bleeding. And then again, don't give them too many fluids. early blood product administration if you have it. And then again, they need to go to surgery most likely. So again, knowing where you're at, getting help there quickly, launch a helicopter, and get them to the right care. Ooh, and that was it. All right, any questions for me?
That was great information, Jamie.
That's a lot. I know I went through a
It was
lot in a little
It
bit
was
of time.
it was really good. You can all go back and watch the video and really like watch it in slow motion too, because
Yes,
so
I
much.
am sad. I was going to tell Chris this is sad. I watched a lady, and I think you talked about this the last time we were there, ride with maybe a 2-year-old in front of her on the ATV. She was behind and no helmet on either one of them. It doesn't matter if you're going 2 miles an hour, something bad could happen. And I'll let you talk about that again, because I know we discussed that before. So I'm going to turn it back over to you, and I'm going to turn down my sound.
All right, well, thank you, and very appreciative to be here today. And I didn't prepare a PowerPoint presentation, and obviously I want to turn this into just a basic conversation between us and you out there in video world. So do have a few notes that I would like to cover, following up on what Jamie had discussed as helmets. Obviously, we can't express that enough. Helmets do save lives. And what is considered a DOT helmet? Well, that is a Department of Transportation sticker or a Snell sticker that's placed on the back of the helmet. So parents or those that participate in off-highway vehicle operation that's listening today, we would encourage you to look for that DOT approved sticker. Reason why it's DOT is because it's rated for that type of high impact sport that's taking place. Bicycle helmet does not work in this world. It has a false, we've heard Jamie talk about false reassurances. Not going to work because it's not rated for a motorized type of impact. So we would encourage helmet wear for all adults. They do save lives. And in addition to that, when one is checking a helmet, Jamie alluded to, obviously, if it's been compromised, if it's been previously involved in an accident or dropped, we would suggest and encourage that helmet be replaced every 5 to 7 years. And so the membrane breaks down in those over time. And a good point to look for when you're buying a new helmet is there's actual date of manufacture sticker or a number or a date, so to speak, listed inside the liner of the helmet. So it's either a sticker or sewn into the fabric. And so obviously, if you go to the store, you're shopping online and you get a helmet 5 of 19, well, it's already 2 years old. So you're behind the curve. So would encourage that you check that out when making that purchase. Jamie also talked about having little people, obviously riding in front of us. That ATV or four-wheeler is what's commonly referred to as is designed specifically for one operator. Some machines and some different manufacturers have 2 different ability to ride double, so to speak. But when that is taking place, you're compromising the center of gravity of that ATV and also impacting your ability to operate the ATV appropriately. So on UTVs, let's shift gears. Sorry about that pun. Shift gears over into the UTV world, or commonly referred to as a side-by-side or a 4-seater. Why wouldn't you want to wear a helmet? There's a lot of exposed metal around your head when you're operating that or riding in it. And so a seatbelt, obviously, we know that from our motor vehicle experience. Seatbelts save lives. So one of the great things that I talk about at times is, if you want to have one of the most enjoyable rides of your life, in less than 8 seconds, you can do a seatbelt, in less than 3 and put a helmet on in less than 5. So a total of 8 seconds, because I would suspect some of us are probably rodeo people, given here in the West, is this type of 8 seconds is really your responsibility to make that impact, to prove to be able to do the right thing. A couple of things I wanted to also discuss is that inexperience also leads to ATV accidents. Basically, riders have 13 times more the ability to, an inexperienced rider, 13 times more will be involved in an accident in the first month of their operation compared to an experienced rider. Now, most of us listening and out there probably have participated in off-highway vehicle riding, and everyone's an expert. Right out, as soon as we ride, we seem well, we're an expert. Well, it takes years to be able to become an expert. And some of those things that can take place is taking an education course, being familiar with how the ATV operates or UTV, along with reading the owner's manual. Developing those skills along the way are vitally important, such as when you're turning, you want to lean into the turn. If you're going downhill, like the picture in Jamie's presentation, you want to shift your weight to the rear of the machine. Those particular riding positions will help ensure that you have a safe, enjoyable experience when in the field. Some of the other things to take into account: lack of adult supervision. That can lead into accidents because you have adults that have hopefully gone through some different life of experiences and are able to be there and coach and guide those young people as they participate in our off-highway vehicle environment. Riding on pavement. The machines are actually designed to be off-highway. That's hence the name Off-Highway Vehicle Program. And so they don't do well when they're being operated on pavement. They are compromised at that point. And so we would encourage individuals and supervisors and parents to take into account of, hey, we're going to limit our operation on pavement and we're going to focus on dirt riding. In addition to that, we're going to minimize our stunts and other dangerous situations that could compromise, once again, our ability to ride within our skill sets for the off-highway vehicle. A couple of other things, I talked a little bit about riding positions. Some of the standard riding positions are you want to be in the correct riding position when you're going uphill. So you want to create enough momentum. You want to have your weight shifted forward to the machine. You want to make sure that if the obstacle, there's an obstacle on the hill, you maybe lower your gear range down into a low gear range and four-wheel drive in order to ensure that that ATV can go up the hill, or UTV. In addition to coming downhill, shifting your weight to the rear of the machine, keeping the center of gravity in tune with harmony as you're coming downhill. Sometimes you may need to stand up in order to see what's ahead of you. Keep your eyes and head up at all times when you're looking into the horizon on the trail system or that open riding area, to ensure that some known obstacle isn't there. If there's a crest or a water situation, you're able to get to go through that. Let's see, I made some notes on my shoulder. Talked about education courses. Couple of things that obviously I'm not an expert when it comes to healthcare provider. Each of you are. You're first on scene, but a couple of things that I want to share with you is shock, and not necessarily that of the patient, but those of the bystanders. That can lead into a different type of environment that, hey, a parent sees their child. All of us have been there. We've seen that, or a loved one, or another spouse is involved in a critical medical situation that causes a hardship. So if you do have the extra set of hands and the ability to have a bystander there, try to, once again, ensure and feed those bystanders the prudent information for themselves, because we don't want to have two victims if there's currently only one that is obviously involved in the off-highway vehicle situation. So let's see, want to talk a little bit about keeping your hands and other appendages inside the vehicle, especially on a UTV. We're seeing a high injury relationship to arms with people as they're not shifting their weight, as they are compromising that center of gravity on the UTV. Very similar like people when they're in a car accident, they want to put their arms out in front of them on the dashboard. Hey, newsflash, breaking news here. Your arm's not going to stop the tip. Just it's going to tip. So embrace it. Make sure you have your seatbelt on. Sorry about that pun. Embrace yourself in the seatbelt. Have a helmet on and keep those appendages inside. The machine's going to go how the machine is going to go. In addition to that, I want to talk a little bit about stopping distance and reaction time. In most cases, reaction time is 1 to 3 seconds. That can be compromised through alcohol or other illegal substances. We've all been there. We've heard it since we've been in kindergarten. I'm not going to hash that again, other than it's illegal to operate an off-highway vehicle and combine that with alcohol or illegal substance. So just a brief tidbit is if you're operating in an ATV or a UTV and you're going at 30 miles per hour, your reaction time is going to be over 100 feet. Your braking distance is going to take that out to over 200 feet. So it almost doubles that, your braking distance in relationship to your reaction time. So once again, be familiar with the machine, know its abilities, know your abilities, and ensure that you ride within those. So, sorry, I'm reading the chat. Yeah, exactly. Thank you for the reassurance. I'm not, apparently I can't chew gum and walk at the same time along those lines. So that's just some information. I don't know where we're at on our time. Okay, well, I thought maybe what I do is just open it up for some additional questions and answers and see if there's other things out there that maybe I wasn't able to cover. We did, one of the things I did not highlight on is taking an education course. By taking an education course, that will help reduce injuries and provide you a so to speak, a building block along the way in order to help facilitate those items that are related to off-highway vehicle use. And so those education courses go into account personal protective equipment, long sleeves, long pants, over the ankle boots, eye protection, along with helmet wear. We talk or discusses also about the additional appropriate gear for first aid, preparedness in case you stay out overnight in an unsafe situation, changing of weather and that type of environment, along with the different riding positions, and then what to do should your machine break down. And some of those basic skill sets that hopefully will give you the right tools in order to ensure that you're an expert rider. That once again, that's more than a month out, an expert rider along those lines. So with that, I'll just open it up to any questions.
Great. Did you see the question? I missed that because there's a crossover with the.
I'm going to have them answer that question, Brittany, for you.
Is it best across your arms?
Is it best across
your
your arms?
abdomen or chest? Did that get answered?
In the event, I would say yes.
Okay.
Yes,
very good.
to that is keeping your arms crossed.
Over your abdomen or chest.
Given the type of environment, I think it's really dependent upon the type of machine that you're in. If you're in a UTV, you may want to look at that more because you're in more of a sitting type of environment where you do have some protection. If you're on an ATV, you may want to look at going around your chest because you got the handlebars in front of you. You may have wood, you may have lumber, you may have rocks, depending upon your riding area. So you're more vulnerable, in my view, on an ATV for across the chest, and more of an abdomen setting if you're in a UTV. Yeah.
So one of the statistics that Jamie had talked about was that 16% of injuries occur in individuals under the age of 16 and under. I'd be interested, I would anticipate, and maybe you can verify that 16 to 25-year-old would be the largest component of injuries. Is that correct, that the highest number of injuries would occur between 16 and 25, or is it more spread out throughout the whole lifespan? I'm waiting for that frontal lobe to be developed at 25.
So a couple years ago, most of you may remember Zach Robinson. We had a great relationship, and it stemmed over with Jamie here. We conducted a campaign called Nobody is Invincible, and part of the University of Utah Health, what they did is they conducted a study. Keep in mind, this was about 3 years or so ago, on emergency room visits. So just leaving it at emergency room visits within the University of Utah system, the average age of an individual visiting for care for injury prevention, 39.87 years old, male.
Interesting.
So I'm not in that class, obviously. The gray hair probably is a good indication. And the reason why that is we believe that adult males may be referring back to that 16 to 25 age
Right.
window and willing to take a little more risks. They also believe that they're an expert rider, and so not trying to be negative in that type of situation, but that's been the target audience that we've tried to focus on. We have seen more of an uptick with the class that you talked about, the age class, Linda, that you talked about here recently. And that's because of the novelist writers, or the nuance writers that are just starting out with the pandemic and people having discretionary income. So they've maybe not have educated themselves. They don't have enough seat time, so to speak, with the machine and understanding how the machine's going to perform, or their ability to ride within their own skill set.
Thanks.
Yeah, absolutely. So you can go to our website, which is ohv.utah.gov. I'll put that link inside the chat box here. And that particular link, you can come across all sorts of information. So we have 4 different types of courses that are available. We leave that up to the parent or the child. They know best on how their child's going to learn, rather than us at the state mandating that. So we have 2 online course providers, and then we have 2 hands-on course providers. One of the hands-on course providers is located in Richfield, Utah. And ironically enough, our second course provider is the Washington County Sheriff's Office. So they're a good way to both of those are experts. They've gone through our education curriculum, so they've met those minimum education curriculum requirements. Our online courses available 247. They are a timed course, so some people out there that may learn a lot quicker. You're still going to have to take some time in order to come back and go through that. So thanks for pulling this up, Amy. So yeah, hopefully that answers the question and along those lines.
Are there any age, like licensure or minimum age that people should be on an ATV, or is it all family discretion or parent discretion?
I didn't hear.
At least to ride alone.
Oh, age range. Oh, thanks, Linda. So here in Utah, our minimum age actually went away beginning May 5th. So there is no minimum age requirement. So any age, as long as they're able to reach and operate the controls, they're under adult supervision, which is someone 18 years of age or older, or they have a valid education certificate in their possession, or a driver's license when they turn 16. Learner's permit does not work. And so we do know, and I'm sure some of you also see that, is in our profession, we've seen riders 5 and 6 years of age who frankly ride better than me. And not saying that, it just, hey, they're a little more proficient on their machine, and some of them are in competitive type of environments known as off-highway motocross racing and things affiliated with that. So no minimum age, but once when you get 16, you get a valid driver's license, then you're good to go. But the education certificate is required.
Yeah. And parent supervision under 16.
Parent supervision under the age of 16.
Yes, so adult supervision required for anyone under the age of 16, no matter they have an education certificate or not. And then they have to be at least 18 years of age, the person supervising that. Yes, unless they're in that education course, and then there's a couple of exceptions listed out there.
Got it.
You just turn your sound down for a second. Okay. We're just going to change sound for a second. So one other thing that I thought about as you were talking about crossing your arms is if you're on an ATV and you feel yourself rolling, tipping, let go. Don't try and control that vehicle. Unfortunately, I think the problem is if you're trying to control it or stop it, you could bring it down on top of you and get a crush injury, dislocation, something like that. On top of it, where if you can at least just try and just let go, like I said, learn how to fall, tuck and roll, relax your body if you can. Less of a chance of you actually pulling that on top of you. I think very important, especially if the kids are doing this education course, is learning that. Inevitably, we're all going to crash at some point in time, whether it be sliding off the road, going too fast around a corner. I can name most people I know have had some sort of accident in these types of vehicles. So it is very important to learn how to adapt to those and how to react when it starts happening to reduce the amount of injury, right? So thinking about that as well.
Yeah, one thing I'd like to add too there, Jamie, is with that is sometimes the accidents occur just simply by loading or unloading. Sometimes people don't tie down their loading ramps, or their ramps are not rated for the appropriate weight of the machine. And so I just want to emphasize that they not only do accidents occur out on the trail, but they can also occur right at the trail head just because of the excitement of wanting to get out, or it could happen in your driveway of loading up. So just wanted to. Yeah, and so given around the state, in certain locations, we have a trail rating system. Our program is actually moving more away from that because different people have different skill sets. So it's very similar to an easy, moderate, or black diamond. There are several black diamond areas located. There's a reason why they're black and considered most difficult. So if you're up for the challenge and you believe that you have that skill set in order to go through that particular or ride that particular trail, I would encourage you. But we've moved away from that type of trail marking system because everyone's skill set is a little bit different. And so we're coming back off of that. Obviously an easy trail, what I would say out of our 80,000 miles of trail across the state, I would say approximately 30,000 of that is more or less geared, towards an easy or a moderate type of system. So yeah.
Wow, there's a lot of information on that on your website with the trail maps and all.
Sorry, Linda, my sound was down. What was that?
Oh, I was just saying that there's that website. It contains a lot of really great information.
Great
with trail
information.
maps and stuff that I saw was really good.
Yeah, and this is going to be something that we do, if not yearly, twice a year for ATV safety. There is unfortunately too many injuries that happen on ATV and OHV injuries. And one thing that we were talking about during the pandemic, I was doing some research for our Trauma Awareness Month, where 60% of Americans are getting back outside due to the pandemic. And like he said, not all of them have the experience or the seat time. I know that ordering a new OHV can come in like September, maybe, if you get it. Like you cannot buy them, you cannot get them because everybody is wanting to get outside. The pandemic has just, I love it. I love that it has recreated our love for nature. I don't love it because I like to be alone in nature, but that's not even the case anymore. But I love that people are out and about. But again, it is a lot of people out there, and I'm for my injury prevention committees across the country, they are all seeing an uptick of these types of injuries from people going out and about. So it's obviously in Utah, happens all the time. So we will continue ATV safety all the time. Again, if not twice a year, covering it, especially in these injury prevention learning series. But it is very important that we're watching for that.
Yeah.
So I know that we're right on the cusp. I'm going to launch this final poll. And as you guys are answering this, leaving it open for more questions, concerns, statements. You can see that Chris put in there, they've seen an increase of over 7,000 additional registered OHVs in Utah and sold over 32,000 non-resident OHV permits. It's big. And it's definitely part of injury prevention because there's a lot of traumatic injuries that we see coming in from these.
Jamie, I can imagine that one thing is that, you know, the 39-year-olds who look back when they were 20, not 25, or the 45-year-olds looking back, the idea of strength, like you perceive yourself to be as strong and maybe you're not quite as in shape. And so people go back and do what they did when they're younger.
Well, we
really
don't like, we don't like to think that things change like that, but our vision changes, our reaction time changes, you know, muscle mass changes with age. Sadly, it's just the way life works. So yeah, you definitely have to know your limitations when you're going out at any outdoor activity, is knowing your limitations. Just like when we talked about before, people that are getting out on e-bikes now that think, oh, it's an e-bike, so it's easy. And next thing you know, they're in the ground because they went too fast, or, you know, it's knowing what your limitations are. And it's hard. It's hard for anybody to say that they have limitations now, right? I mean, even I have problems be like, yeah, I can't do that. But if I stop and think, will I end up a patient in the hospital I work at? And if the answer is yes, I'm probably not going to do it. I know my limitations.
At least get prepped ahead of time.
Yes, I know my limitations, but I'm happy to watch other people do it. All right.
Excellent. That was a great presentation. Anybody else have any questions or things you'd like to hear about in the next time that we do this type of presentation? Just let us know in the chat or turn your screen on.
Yeah, we're starting in summer, fall. So if you guys have any specific things that you want to hear about, learn about, you know, it's mostly specific to Utah activities, but we pretty much do everything except for ocean stuff here. So it's always good. But let us
sometimes
know.
lakes can actually be like oceans at times.
They can. That's what Chris was going to say. They can be. Yes. I mean, we talked about water safety last time. We'll still talk about water safety coming up. Don't worry about that. We got river safety covered right now for this year. We're going to get the non-motorized water sports, and always talking about water safety.
Excellent.
Yeah.
Okay. I think we're right at 12:30. We're going to go ahead and sign off, and we'll plan on, oh, go ahead, Chris, one more comment.
Yeah, what I was just going to add to Jamie's comment about ocean stuff, if any of us have ever boated on Bear Lake and noticed that the color of the turquoise blue water changes to more of a dark green, that means you got about an hour to get off. So the water on Bear Lake actually changes before the Bear Laker moves in. So just a tidbit, helpful information if you're an avid boater up at Bear Lake.
Wow, that's great information. Such a beautiful color, but when it gets dark, we know to move to shore.